Good afternoon. Thank you all for joining in. I want to spend the time today covering three topics. One, the increase in cases that we've seen and what we should all take from that. Two, testing both where we've been and where we're going. And three, additional assistance to our business community from the Coronavirus Relief Fund. First on the number of positive cases. In this past week, there were 69 new cases in the last 7 days. And I know that it's certainly on everyone's mind here, the increase in the number of cases we've seen over the past couple of weeks. And it's certainly on my mind as well. There are a combination of factors contributing to the increasing number of cases. Some of the clusters of cases involve close associations and have been identified through enhanced testing and local contact tracing efforts. This is good news because we're actually able to recognize cases early and to take steps to both prevent further transmission or to slow the spread. And as I've said all throughout, it is expected we'll see more positive cases as we reopen the state and as we increase testing. Additionally, as recommended by the CDC, we are testing all close contacts to a new case, not just those showing symptoms. So clearly the potential to capture more positive cases arising from contact with a positive individual exists. But I do have concerns about the instances where we see community-acquired cases, where cases are difficult to track back to the source, or where cases were acquired from outside travel. Over the past 4 days, we've identified 43 new cases, including clusters in 7 counties and more isolated cases in 4 others. In Custer County, this includes 16 cases, which were the county's first. And most, though, are associated with 2 workplace settings. Some of the cases in Custer County don't even have symptoms, and fortunately, none have been hospitalized at this time. Several of those new cases that we've seen over the last 4 days are also associated with the ongoing outbreak in Bighorn County and on the Crow Reservation. This includes cases identified through recent community screening events. To date, 49 cases in this community and 3 deaths have occurred. Like Toole County, which had experienced an outbreak with 29 cases and 6 deaths, the experience of Bighorn County should be instructive to all of us. And that's any area of the state is still vulnerable to an outbreak and to a loss of life. I also encourage Montanans and visitors to Bighorn County and that area and the Crow Nation to closely follow the stricter regulations that they've put into place. In Ravalli County, several recent distinct clusters were related to travel out of state, as in folks who came in from out of state to Montana, or residents who recently traveled out of state then spread the virus to households or workers' contacts. Lake County has a family cluster that's also limited to either travel from outside the county or to out-of-state visitors. Look, I think it's also certainly important Montanans know when an out-of-state resident who's visiting our state tests positive for the virus. The CDC has residency requirements that dictate how a state counts cases. So a vacationer, as example, diagnosed here in Montana would be counted in their regular place of residency. But it's in the best interests of folks in our state to know if someone has the virus in their community, even if they're only there for a short time being. So we'll be sharing with the press and the public when we provide updates on new cases if we confirm a positive from an out-of-state visitor. It won't be included in our total case count to keep consistent with the CDC data, but it is and will continue to be analyzed as we understand how the virus is interacting in our state. So to place this in context, since we went to phase 2 on June 1st and opened up for out-of-state visitors without quarantining, around 5 individuals from out of state have tested positive while in Montana. And those 5 wouldn't be reflected on our website. Additionally, there's activity in Gallatin, Bighorn, and Yellowstone counties not influenced significantly by out-of-state travel that appear to be more likely clusters of transmission in the community among larger households or social groups. These counties also have some evidence of community transmission or that cases can't be readily identified or associated with another known case. The increase in cases that we are seeing is concerning, but we should also place this in context. Montana has the lowest number of cases of any state in the country. The 3rd lowest increases in cases over this past week. If you look over just the last 7 days as an example, South Dakota would have 5 times more new cases, or Idaho 3 times more new cases than Montana. We still have the lowest positives, the lowest hospitalizations, and the lowest deaths per capita in the lower 48. However, we all have to commit to doing more to slow the spread of this virus in the coming months. We don't want to be taking steps backwards. After how far we've come in successfully maintaining the lowest number of cases in the nation. While recent increases in cases can be partly attributed to the changes in testing practices, such as testing all close contacts and doing more of the community surveillance, it should be evident to everyone that the virus is still very much here. The virus spreads quickly in households and communities and can spread before or in absence of symptoms. While many communities are not experiencing an active outbreak, some are, and the possibility is real for any community in our state. As we enter the summer months and see increased visitation to our state, or while Montanans go out to the brewery or bar or to host a backyard barbecue, we need to learn how to minimize our risk as we continue to live our lives with COVID-19 in the community. We've seen a lot of differences in how businesses have been responding to mitigating risks for their employees and for their customers. There's businesses who are doing things right, certainly having hand sanitizer readily available, wearing a mask, and even offering masks to customers who don't have one, implementing social distancing, and requiring customers, when they're not following those guidelines, reminding them, and also regularly cleaning high-touch surfaces often. But there's also businesses that aren't taking all the steps necessarily that they could be taking. And there's useful guidance for all sorts of businesses, both on our website and on the CDC's website. And of course, local public health offices are always available to help businesses navigate through the guidance and create a safe working or retail space. And we've also seen a lot of differences in how Montanans are responding to the virus. It's so important that Montanans stay home if they feel sick at all. Talk with your healthcare provider if you have concerns. Many providers can see you via telehealth, and we now have testing so much more readily available. In addition to social distancing, washing hands, and disinfecting, let's make mask wearing where social distancing isn't possible a norm in Montana, so that when visitors come to our state, they know this is the Montana way and that they should follow suit. Studies show that widespread wearing of masks in community settings can significantly reduce the incidence of coronavirus cases. And masking up shouldn't be a political or an ideological thing. Remember that people may spread the virus before they even show symptoms. We often don't know what underlying health conditions our friends, our colleagues, and our neighbors may be dealing with. Right now, we ought to be acting and living as if we might have the virus, and that people around us might have the virus as well. We need to take care of our neighbors, our parents, and our grandparents. We need to protect those most at risk, those with underlying medical conditions and older populations, by taking precautions to prevent exposing them to the virus. An update on testing. Testing among vulnerable populations, along with testing of the general population, continues to be part of our main priority in both finding cases and responding quickly if illnesses are found to limit the spread. Nearly 50 nursing homes have completed testing, and all willing will complete in the next week or so. 76 of our assisted living facilities have completed testing, and we're working with our community health centers to complete testing of all the remainder of those in the next weeks. Altogether, almost 4,500 tests have been completed at our long-term care facilities and our assisted living facilities, with no confirmed positives to date. Tomorrow, I'll be visiting with the Confederated Salish and Kootenai tribes at their community testing site. This marks the 8th and final tribal nation in Montana to complete at least that first round of surveillance testing. Not including CSKT, approximately 7,500 tests have been performed during community testing events in the tribal communities, with many more events being planned. Several more communities will be offering community testing in the upcoming weeks. Livingston, Gardner, Billings, and Miles City will offer community snapshot testing this weekend. Next week, Mineral County will offer testing, and Glasgow and Wolf Point are planning for some July testing dates. We continue to work with several other communities to set up testing events in the coming weeks. For the week of May 30th to June 5th, we had completed a total of 7,740 tests. Last week, from the 6th to the 12th, we completed 11,229 tests, so an increase of about 50% from the week before. We continue to work towards and get closer to the testing target of 15,000 tests per week, or 60,000 a month. I'm certainly thankful for the incredible partnerships we've seen across the state in getting these community testing events set up and running. It's only if we all work together that we can keep Montana healthy, physically, mentally, and economically. While continuing to protect the health and safety of all Montanans is really so critical, it also remains a priority to help those economically impacted by this pandemic. Through the Coronavirus Relief Fund, we've been able to consider and begin meeting the needs across all sectors of our economy and in all corners of our state. The funds distributed have gotten Montanans back to work, they've stabilized businesses, they've provided a safety net for individuals, and they've jump-started industries, while considering what support should be available to ensure longer-term sustainability. Over the last 6 weeks, I've announced a dozen grant programs funded by the Coronavirus Relief Fund to support families, small businesses, nonprofits, local governments, and health services impacted by the COVID-19 virus. Through these programs, Montana is getting support directly to businesses, nonprofits, homeowners, and renters. To date, the state has awarded nearly $30 million to around 3,000 businesses and nonprofits to ensure that those organizations can stay open, keep workers employed, and provide needed services to our communities. Today, I'm pleased to announce a new program that we've been working on in partnership with our banks and lending institutions. We know that some of the medium-sized and larger businesses are in need of relief exceeding the $10,000 maximum business stabilization grant and may need more than a one-time infusion of cash assistance. So the program that we're announcing today, the Montana Loan Deferment Program, will allow businesses and other entities to defer payments on existing loans for 6 to 12 months and free up a significant amount of otherwise dedicated capital for the borrower then to leverage on a monthly basis. So those are for existing loans for businesses seeking access to new capital. We're currently developing a program. With the loan deferment program, if a borrower is approved for the program, the borrower isn't going to have to make payments on that loan for anywhere from 6 to 12 months. So if a business was getting a grant of $150,000, for an example, which is the maximum amount, that amount would defer payments on a loan of up to or around $3 million, depending on the terms and the conditions of an individual loan. And under this program, there is no minimum size loan that businesses can work with their lenders on. So if we assume participation of about 20% of the existing commercial loan portfolio in our state, a program of $125 million would allow for the deferral of payments on loans totaling approximately $2 billion. So in short, with this program, dollars are going to go a long way to help support and sustain our businesses in Montana. The time I'm directing $125 million into the program, with $25 million specifically dedicated to hotels and restaurants, then the remaining $100 million dedicated to other eligible borrowers. The amount currently dedicated to this program could help defer monthly payments for between 5,000 and 10,000 different loans and free up capital to bring stability for businesses and other entities in the long term. To be eligible, and all of the information will certainly be on the website, borrowers must have experienced a 25% reduction in gross revenue attributed to impacts due to COVID-19. Borrower must also not have access to 12 months of working capital from any other source and must be actively registered with Secretary of State to do business in Montana. The full eligibility requirements and criteria are available at covidrelief.mt.gov. In the program, it'll be jointly administered by the Board of Investments and the Department of Revenue. Borrowers will apply through their existing lender, who will submit the application to the Board of Investments and Department of Revenue for review and payment if approved. Certainly want to give my thanks to the Montana Bankers Association, Credit Union Network, and the independent bankers in working with us to structure a program that will best work for Montanans, then actually to execute it to get those dollars out the door. As we prioritize transparency with the existing coronavirus relief funds, we'll continue to do so with this program. Recipients will be listed on the transparency website that's updated weekly, and there'll be quality control checks on the front end to get this money out the door responsibly. Over the last 6 weeks, our state agencies have worked diligently to also set up the internal controls to be careful stewards of taxpayer dollars and ensure that the Montanans and businesses receiving the funding meet the eligibility requirements, and then verifying that money's going to the right places. There have been attempts by some businesses to apply for multiple grants at once. We do have controls in place for this purpose, but that's also absorbed some extra time away from agencies to ensure that the businesses are meeting the eligibilities of just receiving one grant. We're committed to transparency in the process, and Montanans should know to where the taxpayer dollars are supporting their Main Street businesses. There has been a lack of transparency from the federal government regarding both the $500 billion allocated to larger businesses and the Paycheck Protection Program loans. And that lack of transparency has made it more difficult for us at the state level to build programs that ensure that no one business is getting a windfall between federal and state programs. Yet, despite some of those challenges, our state agencies also understand that Montanans have been significantly impacted by the emergency and need the relief now. They've managed to get money to businesses and organizations in nearly every county in the state in the last 6 weeks. For example, the Department of Commerce awarded a total of 347 grants last year across every single program in that department. In just the last few weeks, the department's paid out over 2,600 grants in only 2 of the programs. Well, agencies have done great work so far to get this money in the community. Certainly know that much more needs to be done. Department of Commerce is moving additional state employees to help us also move more quickly through applications. In another grant, I'll be allocating $530,000 of the coronavirus relief funds to the Montana Department of Commerce to continue supporting 2020 census promotion and outreach through the new deadline of October 31st. Originally, the census was to be completed by July 31st until it was extended federally due to the pandemic. The legislature had passed $100,000 in the last legislative session to support state outreach efforts, and those dollars were used and spent on the timeline of the July 31st date. Now, the national average of participation to date in the census is at 61.4%. Montana is at a 55% self-response rate. We're ranked 8th from the bottom of states. And we have to do more to ensure that every Montanan is accurately counted in the census. And these funds will help serve that purpose. While the federal government's tasked with counting all households every 10 years, the state supports education, outreach, and promotion of the census. The U.S. Census Bureau had suspended all field operations from March to early May to slow the spread of COVID-19. And Montana's response rate is, as I noted, well below the national average. The funding that we'll be providing will support the state over the long term and ensure that we can do everything we can to get a complete count and our fair share of federal funding for the next decade. The bulk of those funds will be used to buy media to make sure Montanans, particularly in low response rate areas, know why responding is important and to encourage self-response. We know that an accurate and complete count of all Montanans is critical for determining the federal funding distributed to the state for education, highways, health care, and over 300 other programs. The census estimates that the state will receive nearly $20,000 per person who's counted over the next 10 years. Additionally, the count shapes our voting districts and will determine whether Montana will receive a second seat in Congress. So in short, when it comes to coronavirus relief funds, we'll continue to evaluate both the need and demand for these programs and make additional announcements in the future. And it's important to keep some CARES Act funding on hand for future needs that we may not expect, including through changes in federal guidance as we respond to COVID-19 and keep our communities safe. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio from NBC Montana. I'm annoying and have 3 questions today. First, we have 2 new cases in Richland County.
Sorry, go ahead.
Okay.
Go ahead.
Okay, we have 2 new cases in Richland County just reported today. Wondering if the surge in cases is causing any renewed concern over access to ventilators and hospital beds, especially in rural Montana. And when you talk about making masks the norm, I am wondering if you've thought about rolling out measures like Bighorn County to require masks in certain places. And lastly, simply, the loan deferment plan, would those payments deferred be added on to the end of the loan term, and would there be any penalty for taking it?
So, first question, with the number of new cases, do we have concern about either ventilators or hospital capacity? And no, we don't. Look, we're always going to be carefully monitoring and working with our healthcare providers all across the state to ensure that they have what they need, but we're still at like the lowest per capita hospitalizations in the lower 48. We are seeing some states around the country where their hospitalizations are really, really spiking. Certainly every time that I hear another individual goes to a hospital or a loss of life, it does cause concern. But from a capacity perspective, we're still in a good place in Montana. Your second question was Bighorn County is requiring masks. I'm strongly encouraging them. Have I given thought to requiring masks where social distancing isn't possible? No, look, Montanans ought to be taking care of one another. And it's one of these things that I will provide strong encouragement. And I think that certainly local public health, as we've seen in Bighorn County, can take different actions. But encourage it, like, let's not make a big thing of this. Like, let's just do this to try to keep not only ourselves, but folks around us safe. And your third question was, we might allow her to repeat it because that's the problem with Maritza asking 3 questions. And I'll let the budget director answer it.
Yeah, I was wondering if those payments that are deferred will be added on to the loan term, and would there be any penalty for taking that deferment?
Thanks, Marisa. This is Tom Livers. The Coronavirus Relief Fund will cover the interest payments for that period of time, between 6 and 12 months, depending on the specific conditions of the loan. So there will be no interest payments. There will also be no principal payments from the borrowers, because the principal amount will be deferred to the end. The interest will be covered through the public funds up to 6%, and the banks will write down any amount above 6% for that period of time. But the principal amount is deferred to the end. No penalty.
Next question.
Governor, this is Jonathan Ambarian from Montana Television Network. I was just wondering, you mentioned there have been some additional cluster cases that have seen some big spikes in some of the counties. What is it, at what point do you guys begin to look at whether there's any need to look at potentially restoring some additional restrictions at some point? Is that something that you've talked about at all?
Well, I think that, as we've seen, Jonathan, like Bighorn County did decide to put in additional restrictions. And what we've seen by and large, and that's why, I mean, if the message could be taken away that so many of these are within just larger families or one gathering. So we have to be careful in ensuring that we're all continuing to be safe and protective along the way. But at this point, like having said, you know, the cases Look, I don't like seeing positive cases. Some of the best days were when we were at 0. Certainly knew as we loosened up some of the restrictions when we went to phase 2 that we would see additional cases. But I think it's just important for all Montanans to continue to take this seriously. And there aren't any steps right now to roll back at the statewide level where we are in phase 2. Another phone question.
Hi, this is Casey Elliott of the Dillon Tribune. I was wondering about the availability of testing. Our local public health is got 30 kits, and the health center about 100. And they've met recently and wondered just how they were going to be getting more, if they were going to be getting more.
Call him. Or do you want to handle it? Yeah. Jim Murphy.
Thank you for the question. The question was about the supply of testing kits or collection kits out at the local jurisdictions. We did push out a number of kits to all the public health jurisdictions in Montana, both county and tribal. In some smaller areas, that was a small supply that was to get them started with testing efforts with the idea that that would be replenished as they use those. In addition to that, there's partners in those communities, such as the community health centers and the hospitals and larger clinics that are participating in the testing effort. And last Friday alone, we sent out over 20,000 kits to 65 different providers throughout Montana. The ability to resupply the health departments and our partners is in place, and all they have to do is let us know when they feel that they need resupply, and we'll take care of it.
Next phone question.
Good afternoon, Chris Peters, Hungry Horse News.
Hi, Chris.
In the Flathead, they're talking to businesses. They're saying like 75% of their business is from Canada. The border's closed. Have you had any conversations with the federal government on the border, and do you have any grasp at like how coronavirus is doing in the Canadian provinces that are bordering us?
Two things, Chris. Yeah, earlier along this pandemic, I had a couple calls with the premiers in Alberta and Saskatchewan. I haven't, as of recently, had any discussions, and have not had discussions at the sort of federal government to federal government level of as they're looking at how much longer Canada is going to put these restrictions in place. Next phone question.
Yes, good afternoon, Governor. This is Paul Hamby with Billings Gazette. And my first question I've got to is just looking specifically at rural counties and Custer County in particular. Is there any guidance available for health officials within those counties to follow, just with how to deal with issues that are particular to them when it comes to combating COVID-19 and stopping its spread?
So to understand your question, do rural communities have understanding of both what should be done to stop the spread and combat coronavirus? I mean, I guess I'd say two different things, one of which is, local public health officials, urban and rural, both have the information along the way, and our state public health department and our epidemiologists are working with communities large and small.
And then, while Montana's COVID numbers do remain the lowest in the country, we're seeing them creep up into the thousands with its neighbors. And so I'm wondering, just like you said, you reached out to the Premier of Canada, are you in coordination with civic and health officials with Montana's neighbors here in the States?
I'm sorry, you cut out a little bit. Am I in contact with health officials in our neighboring states?
That's correct.
Was just in a conversation, I guess, a day or two ago with the North Dakota governor as but one example. We worked quite a bit with Wyoming governor and their public health side as we were opening up Yellowstone. But as far as, every state is addressing this differently and, doing what, from my perspective, what we've tried to do is take those measures so that we could keep control on our cases and the positives. But the challenges of, look, from out-of-state travel, which as I noted, since June 1, we've only identified 5 individuals that were from out of state that tested positive here. The challenges will only certainly continue in that respect, but it's not just from our adjacent states, it's from, you know, folks all around the country that want to visit Montana. Next phone question, please.
Yeah, hi, Governor Bullock. This is Jonathan Hedinger, Montana Free Press. I was just wondering, so these new cases that you're announcing, are they just par for the course, or are they showing that what we're doing is working with contact tracing and things like that, or is there a reason for people to be alarmed?
Yeah, so I think people should be certainly aware that the virus is still in our midst, right? And that we need to continue to take it seriously. But it's sort of noted
Line muted.
in the body of the comments,
Line unmuted.
some of the increase in numbers that we've seen are because we've changed the way that we contact trace. I mean, we used to, now we test anybody that had contact with the positives. So it's only natural that we're going to see some cases arising from that. Some of the cases that we've seen clearly have arisen, like we've detected them through our greater snapshot community testing, sort of the larger surveillance testing that we've done along the way. And we've seen many clusters, meaning like one household or one event where there are a number of positive cases. So certainly expected additional cases. You can't get much lower than some of the zeros that we're having along the way. But I think it's a cautionary warning to all of us that, and Montana's unique in how low we have the cases, but we're not unique in the fact that everybody should recognize that this virus is still in our midst. And we have to take it seriously, because the way that we keep our cases low really is incumbent upon every single one of us in this state to recognize that we're still, you know, in a time of a global pandemic and a virus in our midst. Next question, please.
Hi, Governor. This is Shaylee Riker with the Bozeman Daily Chronicle. I have a question about testing as well. You mentioned that the state is still working towards this 60,000 per month testing goal, and I'm wondering what it's going to take to get to that 60,000 per month testing goal, and where we're at with it. If you have like maybe a timeline of how long that's going to take, or when we could expect to see that.
Shaylee, I think I noted that we were 11,500 last week, and you know, it's one of these where, look, we're working with emergency rooms to try to get it up and running for folks that come in the emergency room. We continue to work with public health, having weekly testing meetings. I am, but then staff is saying, where all do we need to go? Now, I'll tell you that the number isn't as important as making sure that there's widespread available community testing, first for any individual that has any symptom, and second for our vulnerable populations. Like, as I note that we're just about done with all the long-term care facilities, but we're already in those discussions to say, well, we want to regularly test the workers coming into long-term care facilities. And throughout it all, it really is trying to say, we want to make sure that supply constraints shouldn't be what's driving the discussion. Let's get the tests out as we can and make it available all across the state. Last question.
Hi, Governor. This is Public Radio. Thanks so much for the press sale. You mentioned the 5 out-of-staters who tested positive here. Did they get tested at one of the pop-up testing sites in tourism towns, or can you give us any information about where they were when they tested positive?
Nikki, I'm sorry, I just looked over to Jim Murphy, who's the head of the Communicable Diseases Bureau. Can't give you information on that right now. We're going to get up on the website soon sort of where the positives from out-of-state visitors, the numbers and information about them that, I don't think it was just sort of the widespread community testing, but we'll continue to try to dig in so we can provide some information to you and the press on those. Well, again, thank you all. I guess I'd note that for the loan deferment program, that's going to be goes live on Monday, June 22nd. So for those that apply soon, the interest can begin to be deferred with that July payment. And to just underscore again, we will continue to see cases in Montana. And it really is incumbent upon all of us what happens with this virus. We can only control the things of science that are within our control. And that's still recognizing that social distancing and disinfecting is so critical, that if you're sick, make sure to go see a doctor and don't be out in the community during that time, and do those steps to try to keep all Montanans safe. Thanks so much for joining us today.